Hi everyone, welcome back to Bushabami. I'm Kabo, and I'm going to be giving you a short story time this month about how exercise or lack of exercise can affect your female and male reproductive systems. So a couple of months ago, I had two patients, male and female, who came in and they were struggling with infertility. And upon further investigation and discovery, we realized that the female was the one that was actually having the issue conceiving, because on the male side he had kids previously, his sperm count was normal, sperm mobility was normal, and on the female side she was having very irregular menses. Now when it came to her level of exercise, she wasn't active at all, and she was also very stressed. So if you didn't know, increased stress and lack of exercise can actually affect your reproductive hormones. So it can affect your estrogen, it can affect your progesterone as well, which are the key hormones that are needed in having a regular hormone, releasing eggs, and being able to conceive. Upon further investigation, we realized that because her cycle was so irregular, she then didn't know when she was ovulating. So it was very difficult for her to track her high infertility days. And we had to educate her about that, and also just educate her on how to keep a healthy, balanced diet. Now, a lot of people assume that for you to be healthy, you need to be exercising intensely and eating absolutely healthy, green, no sugar, drinking tons of water, exercise 7 out of 7 days a week. And it's actually not that intensive. You just need to get your body in a state that is healthy enough for you to produce all the right hormones at the right time. So we basically prescribed her 30 minutes to an hour of moderate exercise, because she wasn't an obese person, but she was unhealthy and not active at all. So we prescribed 30 minutes of moderate to intensive exercise 5 times a week. Initially it was 5 times a week, and then we took it down to 4 times a week, as well as drinking tons of water and including way more vegetables in her diet. And then we gave her about a month. We gave her 2 months, and then we told her to come back for a checkup. And she reported that for the past 2 months, she was having a regular cycle. She felt an improved mood. She felt an improved libido. She wasn't as stressed and anxious anymore. And I think 6 months later, she was able to conceive, because she was consistent with her exercise, she was consistent with her diet, and her stress levels had reduced quite significantly. And she was able to better track her cycle, because she was now going on her cycle regularly. So yeah, I think that was a really nice win on our side as a medical professional. I didn't have to treat her with any medication whatsoever. I just had to give her the right education with regards to her exercise and her diet, as well as just help her track her cycle and give her reminders on days where she is highly fertile. Also give her signs of how her body will respond when she is fertile. So how her discharge will look, how her boobs will appear, how her overall mood will feel. And she was able to conceive within 6 months of getting the consultation. So yeah, exercise is very important, not just for your cardiovascular health, your mental health, your respiratory health. It is also very important for your reproductive health. So yeah, I hope that teaches somebody something. And that's all for today.